This is not a venue to air that. So I hope you all understand that. Thank you. And Maura and Kevin.
Thank you. I'm delighted to be here, and I do a lot of speaking, but tonight I'll have one of the shortest rides home ever. I brought a guest this evening. This is the Affordable Care Act. And very few of us have read all of it, but I wanted to bring it to show you that reducing it to about 10 slides is absurd. But nonetheless, that is what I've done this evening. But before we even go there,
Speak to the mic, please.
Right here. Can you hear me?
There you go.
Better?
Yes.
Okay, that's better. Well, I'm not at feedback if I have both. Is this good?
Yes.
Yeah, there you go.
Good. Okay. Feast or famine. Feast or famine. In our business, we see all the time that people tend to not learn very much about health care coverage until someone in the family is sick. And that's because most of us don't utilize a lot of healthcare services when we're healthy. We're very moderate utilizers. Employers or Medicare's often paying the bulk of the bill, so we're not really very interested in learning about health insurance. So tonight I wanted to take a few minutes before we dive into the Affordable Care Act to try to help people understand how did we get here that this massive legislation would be enacted. So let's go back. I'm going to make some of this personal because I know my life better than anyone else's, but and also because it resonates. People remember things. All of my, well, I shouldn't say all, my parents and my in-laws, just 4 of them, all born between 1925 and 1930. Now, all born in major urban centers, 3 in the Northeast, 1 in Chicago, all born in hospitals and delivered by an obstetrician. And how is the bill paid? Cash money. No insurance. So we've gotten to this dilemma of ours just in modern times. So I want to walk you through, I see the 60s, 70s, and 80s as a time of tremendous transformation. And we're probably on the verge of another era of transformation. But let's go back and just briefly see the history of insurance. There's not agreement on how it all started. One group thinks it was the Dallas teachers who banded together and decided, let's pay into a fund and help pay for hospital care if we need it. That was 1929. That's a good enough example. So that's when all of this began. So we have the 30s and the 40s. In the 40s, we have World War II and price control. So that's when group coverage started to truly take off as a benefit being offered. And don't worry, we'll get back to that. A benefit being offered because of the price controls. And the same is true, evolution in the 50s. What I would submit is that in the 50s,